I'd like to thank Dr. Rosenberg for previewing my comments this morning and setting them up so well. We like to think of childhood as a time of innocence, but unfortunately, an extraordinary number of children, both around the world and in the United States, are exposed to violence. In fact, children and adolescents are exposed to more violence than adults. In the last year in the United States, violence exposure, witnessing, and victimization were the rule rather than the exception. 58% of children had witnessed or been a victim of violence in the previous year, whether it was at home or in their communities. And exposure to any one of these domains of violence increases the chance that a child will be exposed to violence in other domains. So children who are victimized or witness violence often do so in multiple aspects of their lives. We also know, of course, that violence is not randomly distributed in our population and that some communities shoulder more of the burden than others. And for children who grow up in single-parent homes, who come from families whose parents have low education, and for those who are racial and ethnic minorities, we see, that, of course, that they are more likely to be victimized than their peers. The health effects of exposure to violence in childhood are striking and broad. While we know that the impact of violence depends to some extent on the chronicity, the severity, and the timing of the exposure, there are some health effects that are persistent across pretty much any time you're involved. So, for example, depression, anxiety, higher risk of post-traumatic stress disorder, of cognitive and attention problems, language delays, problems with attachment to caregivers, and fairly substantial emotional and behavioral dysregulation. We know that many of these outcomes onset early, and they can persist across the life course. In adulthood, there's growing evidence that exposure to maltreatment and violence in childhood actually contributes to the pathophysiology of adult disease and may in fact explain a significant fraction of adult diseases of aging. For example, in the Dunedin cohort in New Zealand, children with a history of caregiver maltreatment and social isolation in the first decade of life were more likely to experience many of the adult diseases of aging, and it is now considered to be potential that childhood exposure to violence is part of the pathophysiology of adult disease by increasing inflammation and by increasing metabolic risks. How it is that childhood exposure to violence comes to be embedded in the biology of child development, that it gets underneath the skin, has been a focus of intense research. And clearly this is an area in which we are only in our infancy in our understandings. But much of what we know is related to the neurobiology of fear. So if we go back to the proverbial lion and zebra on the plain, we all know that exposure to threatening environments activates our sympathetic nervous system, that in turn choreographs a complex set of behavioral and biological responses that prepares us for fight or flight, and also makes us incredibly vigilant to our environments in order to perceived danger. Well, this chronic state of unpredictability, harsh environment, can in turn dysregulate the complex communication that we see among the neuroendocrine, immune, and metabolic systems. And in turn, this may give rise to what has become known as defensive phenotype. Defensive phenotype is characterized by increased vulnerability to our environment, increased activation in response to both biological and behavioral stimuli. In time, defensive phenotype can also have long-term impacts on learning, cognition, emotion regulation, and social information processing. So this is a case in which specific kind of adaptation to one's environment can go on to have extraordinary negative consequences for children and for adults. The brain, as we all know, is particularly sensitive to environmental input during sensitive periods in development. So these are the prenatal period, childhood, and adolescence. Exposure to violence in childhood is particularly damaging for two reasons. First, that it jeopardizes environmentally expected caregiving relationships, which are important to developing strong brains and healthy stress response systems. In addition, childhood violence also floods the brain with aversive stimuli at a time when it is particularly vulnerable to those disruptions. As we know, exposure to childhood violence ultimately can disrupt the architecture of the developing brain, and those changes may be magnified developmentally as disruptions in one part of brain development go on to impact those in subsequent stages of brain development. Among the parts of the brain that are most vulnerable to environmental stimuli related to early childhood violence exposure and its correlated adversities are the hippocampus, amygdala, and prefrontal cortex. And in contrast to the slides that Dr. Jones showed this morning, we see that children who are exposed to violence, to caregiver maltreatment, and to social isolation are more likely to be hypervigilant to emotional stimuli in their environments. We see, for example, in neuroimaging studies that children who are exposed to fearful or angry faces tend to be particularly transfixed by them, and that they show huge activation in their amygdala compared to their non-exposed peers. And again, this is a place in which it's incredibly adaptive to be a child if you're growing up in an uncertain environment, to be good at understanding when somebody might be angry with you or when somebody might want to do you harm. But in turn, this has long-term costs for emotion regulation, for behavior regulation, and ultimately for the development of psychopathology and for later aggressive behavior. So, in part, because of these biologically embedded changes in emotion processing and social information processing, children who are exposed to violence in childhood are more likely themselves to go on to offend. And quite poignantly, we see that the very characteristics that are associated with resilience to this kind of early adversity, for example, good attention skills, good social information processing skills, strong and supportive family relationships, are the very skills and capacities that are most chipped away by these early violence experiences. Ultimately, then, childhood exposure to violence is a potent source of social stratification in our communities. Children who are exposed to violence go on to be adults with lower socioeconomic status and poorer health. And so, if we take a life course perspective to childhood exposure to violence, it helps us to better appreciate the need to invest in families and communities at times when children are particularly sensitive to their environments. This is helpful to close the gap that we see in health and achievement disparities and to interrupt cycles of violence. Because as we have observed in this country for more than 200 years, it is easier to build strong children than to repair broken men. Thank you.